Symptoms of low potassium, hypokalemia. If your blood potassium level is less than 3.5 mmol per liter, you have a low potassium level, or potassium shortage. In the medical world, it is referred to as hypokalemia. A vital mineral with several functions in your body is potassium. For instance, it aids in controlling fluid balance, maintaining healthy nerve activity, and controlling muscular contractions. Potassium insufficiency can happen if a person consumes insufficient amounts of the mineral through food or loses too much of it through prolonged vomiting or diarrhea. Symptoms might include high blood pressure, constipation, renal troubles, muscular weakness, exhaustion, and heart problems, depending on the degree of the deficiency. Subscribe our channel and hit the bell to watch more videos like this. If you have any question about your health, comment below. Causes of potassium deficiency. Potassium is necessary for your body to function properly. The foods you eat provide potassium for your body. When you vomit, have diarrhea, or use laxatives frequently, your digestive system loses a lot of potassium, which can lead to hypokalemia. Other causes include a few genetic and adrenal conditions, as well as some medications. Potassium deficiency symptoms. The following list covers 8 potassium insufficiency symptoms and indicators. Number 1. Fatigue and weakness. For several reasons, weakness and weariness are frequently the initial symptoms of potassium insufficiency. First off, potassium assists in controlling muscular contractions. Your muscles contract with less force when your blood potassium levels are low. Second, a lack of this mineral may have an impact on how your body utilizes nutrition, which may contribute to exhaustion. For instance, some data suggests that a deficit could affect insulin synthesis. High blood sugar levels and less glucose that is readily accessible, which is used by your cells as energy, might result from this. Number 2. Weaken muscles and cramping. Muscle contractions are started and stopped by potassium. This equilibrium can be upset by low blood potassium levels, which can result in cramps, which are uncontrollable and protracted contractions. Potassium aids in the transmission of brain messages to your skeletal muscle to trigger contractions. By exiting the muscle cells, it also aids in stopping these spasms. Low blood potassium levels make it harder for your brain to transmit these impulses. Number 3. Digestion issues. Digestion issues can have a variety of reasons, but severe hypokalemia is one of them. Potassium aids in the transmission of impulses from your brain to the smooth muscle in your digestive tract. These impulses cause your muscles to contract, which churns and propels food through your digestive system so it can be digested. Low potassium levels may cause the digestive system's contractions to weaken and cause food to move more slowly. Digestive issues including bloating and constipation might result from this. Number 4. Abnormal heartbeat. Additionally, potassium is essential for sustaining normal cardiac muscle contractions. This is so that your heartbeat may be controlled by the potassium that moves into and out of your heart cells. This flow can be altered by low blood potassium levels, which can lead to cardiac arrhythmias or irregular heartbeats. Number 5. Breathing problems. Breathing problems might be brought on by a severe potassium deficit. Your diaphragm, in particular, is a muscle that is used during breathing to assist the lungs in taking in and releasing air. Your lungs may not adequately expand and contract when blood potassium levels are extremely low, which can cause shortness of breath. A deadly potassium deficit may even cause the lungs to stop functioning. Number 6. Numbness and tingling. Although prolonged tingling and numbness are more typical in patients with high potassium levels, or hyperkalemia, those with low potassium levels can also have these symptoms. This condition is referred to as paresthesia and typically affects the hands, arms, legs, and feet. To maintain proper nerve function, you need potassium. Nerve impulses may be weakened by low blood levels, resulting in tingling and numbness. It would be better to speak with a doctor if you experienced this. Polyuria, frequent urination. Frequent urination. When you have polyuria, you urinate more frequently than normal. The kidneys are in charge of maintaining a healthy balance of fluid and electrolyte levels in your body and eliminating any waste through urine. In some cases, low potassium may impair your kidney's ability to regulate your body's fluid and electrolyte balance. As such, you may feel the need to urinate more often. Number 7. High blood pressure. People with potassium shortage may sometimes suffer prolonged tingling and numbness. However, this is more typical in individuals with high potassium levels, or hyperkalemia. Paresthesia is what's happening here, and it often affects the hands, arms, legs, and feet. For good nerve activity, potassium is crucial. Numbness and tingling are symptoms of low blood sugar, which can inhibit nerve impulses. It's advisable to call a doctor if you encounter this. How to treat hypokalemia. The majority of the time, a medical expert must handle the treatment of hypokalemia. Oral potassium supplements are commonly used to treat mild to severe hypokalemia. Your healthcare provider could occasionally also need to modify any additional drugs or address underlying issues including vomiting, diarrhea, or eating problems.
Please subscribe our channel and hit the bell icon to watch more informative videos like this.